Great. You're just finished filling in that piece. Now, I just want to make sure how important your answers are to that piece. Now, our first question was on sleep. If you are sleeping well, yes, super. Sleep is when your body catches up and heals, repairs, and revitalizes. Obviously, you need good sleep. Now, if you're not sleeping well, probably the repair mechanism is not working well. You are probably having more illnesses and your recovery time is probably increased, which means your body is struggling hard. Now, if it keeps on doing that, it sometimes goes into a bit of, if this condition continues for longer period, then you are probably likely to have an impact on your physical health, mental health, and social health. Now, let's see what will happen to your physical health. On the physical aspect, you may have high blood pressure, heart disease, stroke, obesity, diabetes, reduced immune function, and cancer. Now, it might also affect your mental health, which means you will be stressed, depressed, and anxious. It may affect your mental ability, which is you will have lack of concentration and lack of learning ability. On the social aspect, it might even impact your social interaction. Now, our second question was on peace. Now, if you are peaceful, you are living a fantastic life. When you are in peace, you are relaxed, you are grounded, and you are stable. Life is like a peace. When you are not peace, you are mentally disturbed. Now, this mental disturbance can cause you anxiety, then stress and depression. Now, if you are mentally disturbed, that mental disturbance can cause you secretion of adrenaline and noradrenaline. Now, these has impact on your physical aspect. What will it cause to your physical aspect? It will increase your blood pressure. Again, it will increase your risk of heart disease, risk of stroke, risk of obesity, and risk of diabetes, reduced immune function, and cancer. Now, you may be on multiple medications for these medications, and you may be experiencing some side effects of these multiple medications. Potentially, you will lack the clarity of mind, lack of concentration, and lot of learning ability. So you can clearly see that how a single aspect of your life can impact all the different quadrants of your. The next question was on how do you score yourself on happiness? If you are happy, excellent, outstanding. Happiness is something that people look for all the time. Now, if you are not happy, your lack of happy hormones are likely to affect again all the quadrants of the day. Now, on the physical aspect, it might impact, as I mentioned earlier, in different aspects like heart, high blood pressure, diabetes, and so on. On the mental aspect, you might feel depressed, stressed, and again, you can have low mood. It might affect your social interaction, personal growth, self-esteem, and confidence. Now, you can very well imagine what will be the condition of your quality of life if all the facets or all the quadrants of your health are affected. Our next question was on relationship. If you are having a fulfilling relationship, wonderful. Life is again like a bliss. You are living a meaningful life. When you are having a fulfilling relationship, you are safe, you feel supported, you feel accepted, and you feel respect. You accept each other and you understand each other. But if you are not happy, you are probably anxious. You are probably frustrated. You are probably disconnected from your partner, insecure, even feeling unsafe. Perhaps you are having domestic violence, social isolation, and it's affecting all parts of your life. Possibly, this relationship is affecting your mental health, self-esteem, and confidence. Potentially, this relationship is affecting all the other aspects of your life so that it is making your life even more challenging. The next point was on spirituality. How did you get on with spirituality? This is something which is very abstract and intangible. However, the spirituality means when you are related, really connected to your inner self or your real self. If you have answered well in this question, you must be feeling a stable, peaceful mind. Now, if you are not, probably you think you are a master of your life and you will make your journey memorable and pleasant. Perhaps you are having troubles with stumbling blocks in your life. Now, as a result of repeated struggle throughout your life, you might face some effect on your physical, mental, and spiritual aspect of your health. Potentially, you are aimlessly wandering without any purpose and without any peace. That's one good. The next point was meditation. How do you get on with meditation? If you are doing well, if you are already meditating, then you are probably experiencing some of the benefits of meditation. Marvelous, excellent. Now, if you are not meditating, you are probably having a bumpy life with ups and downs in your life. Perhaps every time you try to have a grip on your life, it just slipping away. Probably you are anxious, stressed, and depressed. Possibly it's affecting your health and well-being. Potentially, you are giving up hope of getting any control on your life, and you just want to just go with the flow, which is again not enough because people like to have control on their life. Now, this is time to take responsibility of your own health, on your own and maintain healthy life throughout